morning show of the Louisiana delegation to the legislature.
Okay.
Also of Jesse Duplantis, Jesus Jet.
Oh, the Jesus Jet.
Official morning show of that
Okay,
thing as
all
well.
right. Yeah.
Another fan, we hear, Senator Bill Cassidy. He joins us on the phone now. Lots going on in D.C. today. Good morning, sir. How are you?
Hey, Rob, Bernie, I am fantastic. How are y'all?
We're doing great, and we're happy it's a Friday. Whew.
Hey, any day's a good day, gang. I mean, my gosh, we're alive, we're blessed, in the greatest country in the world.
Well, yeah, those are all good points, too.
I want to ask you about something that really, it has warmed my heart ever since we first knew about Steve Gleason's battle with ALS. Then I saw the movie Gleason by myself here in Lafayette and got back to my car literally with tears coming down my face thinking, wow, I need to do more in the world because this guy is doing so much to put a face on a disease that a lot of people didn't know too much about 5-6 years ago. Well, yesterday, your bill to award Steve Gleason the Congressional Medal of Honor passed in the Senate. How cool is that?
It is incredibly cool. And as I said in my remarks, that blocked punt first game back in the Superdome after Hurricane Katrina, it was just a signal. The Gulf Coast was not going to surrender. We were coming back. Everybody cheered, blows the top off the dome. It's almost like that same attitude is what, in fact, it is. The same attitude, we're not going to surrender, is what Steve brings to Lou Gehrig's disease. He is not going to surrender. He's going to work. He's going to live. He's going to strive. He's going to make it better for others. I'm with you, man.
So where does it go next? Obviously, since it's passed in the Senate now, I would imagine it heads to the president?
No, so it's a congressional gold medal. Mm-hmm. We need 2/3 of both the Senate and the House. Now, in the Senate, you actually have to get people to co-sponsor. And it took us 2 months, but we've got 70 people. To put that in perspective, there's 4 or 5 other congressional gold medals out there, but no one has, I think, over 55 votes. We got 70, and could have ended up with 100. It's just that we only needed 70, only needed 67.
Wow.
On the House side, they don't have to get signatures. They just put it up for a vote, and if people want to do it, they vote yes, and we got it. We think it will work for us. We got Scalise, Cedric Richmond, head of the Black Caucus, Kathy McMorris-Rogers from Washington State. She's in leadership. So we think it can pass over there, but until it does, it hasn't, but we think it will.
Well, when you start to look at the other recipients of this award, whether it's Billy Graham to Frank Sinatra, Mother Teresa, Rosa Parks, I mean, Dr. Martin Luther King Jr., what a cool group, and kudos to you for putting Steve Gleason's name out there, because I do. I think a lot of people know what it is through him, and maybe they know some of the signs. Unfortunately, it's incurable at this point, but hopefully work will be done on that. I want to switch gears a little bit to talk about something else, and it has to do with veterans and the VA. This is something that a lot of people ran on back in 2016. Have we seen, as we come up to midterm elections, have we seen the changes we had hoped for since then in the last couple of years?
The VA will not turn on a dime. You've got to begin to change the culture bit by bit by bit. Now, we've seen progress. We've seen new VA clinics built in Lafayette and Lake Charles. We've seen new systems put in place. For example, they're updating the electronic medical record that will replace the one that's outdated. It'll be a better way to integrate with the Department of Defense. So someone will come out of the active duty and into the VA, and instead of having 2 different medical records, it'll be seamless. We've cut down on the backlog of disability payments. The president just signed into law a bill making it easier to get rid of people who are incompetent employees. We got a long way to go, but it's a bit by bit trying to make it better.
And the VA Mission Act, I would imagine, shores up a lot of those things, especially reestablishing, like you said, what things are important going forward. Because, I don't know, maybe when things get a fresh set of eyes, things that were once important may not be as important anymore. And new things, I know mental health is a big one. Look, that's something that's being treated now with our wounded warriors and veterans like has never been treated before, just because society's kind of changed.
So I've been really working hard at understanding some of the suicide issues among veterans. It turns out that you're more likely to commit suicide as a veteran if you were never deployed. If you're in combat and come back, you're less likely to commit suicide than if you were never in combat.
Wow.
Now, that is so counterintuitive.
Yeah.
Mm-hmm.
So we're trying to get to the bottom of that.
It almost seems like a guilt for not having to actually
Survivor's
fight.
guilt.
Yeah.
I don't know that.
Uh-huh.
But what we do know is that the highest rate of suicide among vets is between, I think, 3 and 12 months after their separation date. So there really needs to be help with that transition. How do you go back into society, reintegrate with your family and with your community? We had a hearing yesterday approving a new Assistant Secretary of Labor to help with Veteran Affairs. And seems like a great guy, but that was my point. If this is where we're having the problem, we need to break down the silo between the mental health folks and the transition folks and make sure it works for these folks as they come out. And then we got to look at DOD. Why are people who are never deployed at a higher risk of suicide than those who are? So we're working at it. We're trying to understand it.
I want to ask you something as we wrap up. We're joined, by the way, by Senator Bill Cassidy on the phone this morning. I know you have a lot bigger fish to fry in the work you're doing with veterans and everything. I think is so great. I want to ask you about what's going on here in our state, obviously because you are a doctor, and it seems like our conversation about the budget here in our state keeps coming back to funding, to health care. I think the latest estimate that I've seen is like that chunk of the budget is like 46%. Almost half of the budget is going toward health care, and we're still one of the least healthy states in the country. Your thoughts on that, your thoughts on the budget in general as we wrap up this morning?
Rob, man, you just gave me something like the 10-hour discussion.
Yeah, please get to that in 30 seconds, please. Thank you.
Well, if you're talking about us being the most unhealthy state in the nation, not entirely, but in large matter, it is dictated by social determinants of disease. We have the highest rate of obesity. We don't exercise enough. We have open container laws so people can drink and drive more easily. We have a high rate of HIV. And that's not because people aren't taking medicine, it's because people are being promiscuous or using drugs. So you got to address those. And you can have all the doctors and all the Medicaid in the world, but you're only going to make a limited dent in that because a lot of those are lifestyle diseases. We got a great state. We love to be here, but for individual health, probably need to exercise more and watch what we eat a little bit more.
Senator Bill Cassidy, we appreciate your time this morning as always. Keep fighting the good fight, sir.
Thank you. Always love talking to you all.
Have a great one.
You too.